We've been talking a lot about headaches, and I just want to talk a little bit different about 7 drugs that have just transformed my practice in the last 20 years. They've just come out in the last 2 or 3 years. 4 of them are the monoclonal antibodies. Monoclonal antibodies block CGRP, which is calcitonin gene-related peptide. It's involved in pain perception, and the levels are greatly increased during a migraine headache. CGRP causes vasodilatation, inflammation, and increased sensitivity. If you remember, vasoconstriction followed by vasodilatation, which is what triggers the headache. We use them for chronic migraine, episodic migraine. There are 4 of them. Amiovig was the first one that came out. It was the first new really class of drugs. It was really a game changer. And it was the first one. You use it once a month, a sub-Q injection once a month. And it blocks the CGRP receptor. And we give it 3 months. So many people take it a month and don't want to keep taking. Give it 3 months. Give it time. Rare side effects we've seen, mainly injection reactions, sometimes hypertension. I've never seen that. Constipation is something you see in some of the older people. They've seen some GI obstruction. I haven't seen that. Don't worry about it, but discuss it with your patients. Ajovy is the next one. It blocks the ligand, the CGRP ligand, the same type thing. It's once a month. Try it for at least 3 months. Just have to take a shot once a month. Emgality is one of our favorite, Amiovig and Emgality are my favorite. Once a month, you bolus them with 240 milligrams and 120 milligrams. And we've been over all these side effects in the other video. Then Vyepi is sort of the new one. I have not used it because it's IV every 3 months, but if they fail everything else, it'll be worth a try. So that's 4 of them. The other 2 are G-PANTs, and we're using a lot of these. Nurtrec has just transformed our practice. It's a pill, so you take a dissolving tablet, take it every other day, and we even use it for prevention now. It's just a great drug. 50% reduction in migraine drugs, and then Quilepta was the next one. Quilepta is another great drug, and it's once a day. It's a CGRP receptor antagonist. And then the 7th drug that's transformed our practice is Botox. We have a whole other video on Botox for chronic migraine headache. I've been using Botox for 40 years for twitching and hemifacial spasm, dystonia, wry neck. And when it came out for migraine, I wasn't really committed that it was going to work, but I've been shocked at how well it works. It just works great. 31 small injection sites. It just works amazing. So watch the video on Botox. So those are the 7 new drugs that I probably use the most, along with all the old ones. But they are game changers that transform the treatment of migraine headache. So this is Dr. Caudill Miller, the Brain Doctor. Like, comment, subscribe. I do answer every comment. So if you got something you want to say, send me a message. More later.